Suturing the iris, or correcting the shape of the pupil. That's what this video is going to be. We had a patient who underwent phaco and he moved during surgery, resulting in inadvertent grabbing of the iris with the phaco tip. The pupil was damaged, and so we offered to correct this patient's pupil shape because he was bothered with the resultant pupil shape. So I'm going to show you single pass, 4th row pupilloplasty to fix this gentleman's iris. Well, first let me give you context on how our patient's pupil was damaged. And it's rare, but it can happen to the best of us. Everything's going along perfectly. There's a tendency for complacency to set in, and just when you think you've got everything squared away, let me show you what happens. This is routine phaco of a 3+ nuclear cataract with a 5.5 millimeter pupil diameter. Cataract surgery is proceeding normally during phaco emulsification when I accidentally aspirate the iris during phaco and damage the pupil and the iris. We then finish the procedure and avoid touching the iris during the rest of the surgery. But at the end of the cataract surgery, this is the appearance of our patient's pupil. Then we see our patient the next day, look at the pupil and iris, and see this appearance, which is not great for the patient. We inform the patient of the situation and let him know that we can surgically repair the iris in the future. So this video is 2 months after the original damage to the iris. This is my view of the eye as I'm sitting above his right eye. The area of iris damage is highlighted at 3 o'clock. My goal is to reoppose the iris with 2 sutures of 10-O-proline. 1% lidocaine is placed into the eye for anesthesia. The unintended consequence is the pupil dilates from the anesthetic and viscoelastic placed into the anterior chamber. To make the ergonomics of surgery more in my favor, I move from sitting above the right eye to sitting temporally. Several 1 millimeter incisions are placed, which allow me to place the 10-O-proline suture shown in these images. With the pupil dilated, it is more difficult to identify the pupil sphincter. The first 10-O-proline is placed where I think the pupil sphincter is located. The proximal and distal iris tissue is stabilized with MST Ahmed forceps to allow passage of the 10-O-proline needle. The viscoelastic cannula is used to receive the suture needle through our 1 millimeter secondary incision. The suture is then exteriorized, followed by retrieval of the internal suture with a reverse Sinskey hook that allows me to create an exterior suture loop through our left secondary incision. Next, the suture end that was initially created is cut short to allow me to grasp this end and pass it through our newly created suture loop 4 times. Then we grasp both suture ends, which brings the newly created knot from outside the eye where it reapproximates the damaged iris tissue. The ends of the suture are cut with micro scissors. Once the iris is reapproximated, I can now see where we need to place our second suture. We repeat the same process with the 10-O-proline and Ahmed forceps to engage the iris and exteriorize the needle. The reverse Sinskey hook is used to create an internal loop of suture that is then exteriorized and expanded outside the eye. We then take the end of the suture and pass it through the loop that we created 4 times. In this instance, I wasn't sure if I made 4 passes, so I actually made a 5th pass through the suture loop with my suture end. The 2 ends of the proline are then pulled to bring the suture knot inside the eye to reoppose the iris. When the suture is tightened, the appearance of the pupil and iris look pretty good to me. So the suture ends are cut with micro scissors. Viscoelastic is then removed from the eye. Incisions are hydrated, and at the end of surgery, in my opinion, the iris and pupil look cosmetically acceptable, and we end the surgery. This is the appearance of our patient's pupil the next day in the office.
Overall, he was very satisfied with the appearance of his pupil and iris. So, although we created the problem to this patient's iris during surgery, we were able to successfully repair our patient's iris to make him happy in the end.
So as always, thanks for watching this video. Hope you enjoyed it. See you on the next one. Cheers.